very good day to you. Now we are addressing our minds to the prevention of mother-to-child transmission, PMTCT, of COVID-19, severe adult respiratory syndrome is a form of it. COVID-19 is a form of it, of SARS. Well, it's an emerging infection now known globally for about 8 months, and we believe it originated from Wuhan in China. And the virus is an RNA virus, ribonucleic acid virus, that is about 125 nanometers in diameter. And concerning the epidemiology, it has been reported that as at 9th of August 2020, there were 22 million cases worldwide, and the mortality at that time, 333 cases, according to Johns Hopkins, United States of America. And from the Africa Center for Strategic Studies, they have reported that in August, up to August 2020, there have been 1,035,919 confirmed cases in Africa. What are the clinical features of COVID-19, a form of SARS? The incubation period ranges from 2 to 14 days, mainly and by respiratory droplets and aerosolization. Sexual transmission has not been confirmed. Data still emerging concerning vertical transmission from mother to fetus. However, histochemistry studies have identified placental invasion by the virus in a few studies, but we still await more studies to confirm this. What about the symptomatology? It can present with cough, fever, sneezing, itchy throat, malaise, that is feeling unwell generally, anosmia, not able to perceive odor, or loss of taste, weakness, breathlessness, exertional dyspnea, etc., etc. The clinical cause, it can be asymptomatic, it can be symptomatic, and when it is symptomatic, it can be mild, it can be moderate, it can be severe or critical. If it is severe or critical, it might need ICU admission, and of course in critical, almost always, ICU care is mandatory. Why? When it is severe or critical, there will be cytokine storm. That is, the inflammatory process in a particular organ, especially the lungs, will be so severe as to be so symptomatic in the person being breathless, dyspneic, weak, and of course, the oxygen tension will be so low. For us as human beings to function optimally, our oxygen tension has to be 95% or above. When the oxygen tension is less than 90%, there will be problem. But in these people, in affected people, the oxygen tension might be low as 70 or even worse. And that's why many people die from organ failure, multiple organ failures because of this. While talking about, like I said, it's still an emerging disease. Emerging infection. Things we are still learning more and more, day by day. And I guess if we can borrow from our experiences in HIV management, it took about 2 to 4 years before we knew much of what we now know about HIV. The first 2 years, we could not get any drugs to use, but later we now found out what HIV. The same thing is happening to COVID-19, a form of SARS. So many things are emerging now. We're now knowing more and more by the day. What then are about the clinical management? The modalities of management has to be multidisciplinary because every organ from head to toe can be affected. But initially, the lungs, the respiratory system is affected. So there should be initial laboratory investigations and follow-up, antibody and PCR tests. PCR is polymerase chain reaction test. And the turnaround time should be as short as possible. But we still have in our communities the turnaround time being, the shortest I've had is 72 hours, 3 days. Some still have it up to 5 days. The shorter the turnaround time for all these tests, the better. And I know that in Israel, they are making some tests to use saliva, and maybe, yes, and I'm believing in a short while, we'll be able to have such tests globally all over the world. And within a few minutes of the person reporting in a healthcare facility, that can be done. And we can know the status of the person and start treatment immediately. So baseline tests, depending on organ involvement, supportive therapy, bed rest, isolation for positive cases, respiratory support. I should mention that isolation for positive cases and all contacts. So contact tracing should be done. So there should be isolation for such cases. And of course, there should be respiratory support. Usually there is high flow nasal oxygen being given. There should also be nutritional support, vitamins and micronutrients like zinc, and of course, adequate fluid intake. Now, talking about prevention of mother-to-child transmission of COVID-19. So, some of the COVID-19 related therapies we now have are giving of ARV. The ARV that is commonly given now is remdesivir, a nucleoside analog. Like I said, things are evolving. And we still want to see many more, to confirm many more cases. It's not yet widely believed that it's transmitted. So that's why we are just talking about this. And prevention is always better and cheaper than cure. So if we prevent the mother having it, the unborn baby in utero will not have it or while being born. So we give ARVs, remdesivir, which is a nucleoside analog, and we can give steroids like dexamethasone, which is anti-inflammatory. People have talked about convalescent plasma, which is the plasma obtained from someone who has recovered from COVID-19 infection. And because of clots, thrombi in multiple organs in the body, people are now giving anticoagulants, heparin, clexane, aspirin, and what have you. Anything as an anticoagulant will be necessary in the care of the patient with COVID-19. Then, of course, all over the world, people are now looking forward. There is a race now to have a vaccine. Breakthrough is still being awaited, but well, the Russians, they said people are still testing what they have offered. We are waiting from Britain, Oxford, the Americans too. So globally, there's that competition to have an effective vaccine. I guess in a few months' time or by the year 2021, we'll have an effective vaccine. We are still waiting. It appears as if the world is still waiting on tenterhooks to see when this will be. And of course, people have mentioned hydroxychloroquine, but this is very controversial. Very controversial. And of course, the usage of azithromycin. Azithromycin is used against bacterial infection. COVID-19 is a viral infection. People have argued that because there could be a concomitant bacterial infection when there is COVID-19 infection, that's why they offer that combination of hydroxychloroquine, azithromycin, and zinc. Some have mentioned vitamin C, ascorbic acid, etc., etc. Like I said, it's an emerging infection. Things are being churned out from trials, from observation, from the laboratories, almost on a daily basis. So hydroxychloroquine is very, very controversial. But that's what we have in our armamentarium to combat COVID-19 infection. Now, the mode of delivery should only be because of obstetric. When we are going to deliver an infant or a fetus born to a woman positive for COVID-19, the mode of delivery should only be because of obstetric indications or condition of affected patients. And I advise that there should be individualization of each case as they present. You treat the woman holistically so as to know how to deliver. Of course, there are only two routes of delivery of a baby, the natural route and abdominal route, cesarean section. So, COVID-19 infection per se should not be an indication for cesarean section, such as HIV infection per se is not and should not be an indication for cesarean section. But you must look at all the parameters concerning that mother-fetal pair, mother-infant pair, and one should take his or her decision to know how the woman should be delivered. In the postpartum period, mother might still need high flow oxygen. Some reports have mentioned that. Okay, we are still looking at this. Maybe in a month's time, what I've written here will have changed. Okay, and that's why this I've put up is tentative. Okay, there are things that we have garnered over the few weeks and months, or the few months that we have had COVID-19 all over the world. Then the mother postpartum might still need high flow oxygen, and they're still talking about whether we should separate the infant from the mother who is positive or not, while the mother has all her PPEs on. And of course, we now believe we might not have the virus in the breast milk, but many reports will come out and we will know very soon. So there are people who advocate separation, and there are people who advocate not separation of the infants, depending on the condition of the mother anyway, and the severity of her own illness. So, and the feeding options, because of the presence of the virus within the breast milk, has not been conclusively proven. Some are saying the woman could the baby could be fed with the mother's breast milk, maybe expressed. If her condition is serious or critical or whatever, the infant should be separated from the mother, and the baby can have expressed breast milk from whatever source, or formula feeds. So these are things still going on, and I guess that in a few months' time, by sometimes early 2021, things will be clearer. Such that earlier, some 4 or 5 months back, people were advocating ventilator. We now know it is much more than ventilator. It is because of clots in many organs that many organs fail, and the care is now different. It's different. Okay, so that's it. But now, the essence of care now is to follow the public health guidelines. Prevention, because prevention is always better and cheaper than cure. Prevention is always better and cheaper than cure. So what I will advocate now is that as many pregnant women as possible, as many women as possible should be prevented from having infection with COVID-19. And when they are not infected, they will not be able to pass it on to their infants. And so we must follow, because of what we have now, mandatory mask wearing for those who are infected and those who are not infected. And that's why in public, and there are specific guidelines, public health guidelines all over the world now, mandatorily, people should be putting on masks when we have many more people gathering, social distancing or physical distancing, and our coughing and sneezing etiquette, we all follow. And of course, isolation of index cases and testing of contacts. These are the public health guidelines that we now advocate. So, thank you. Thank you.